Yes, we're going to talk about, these two studies we had really on the impacts of banning smoking in cars that have children in them. So smoke-free legislation, as probably know, is linked pretty established relationship with health outcomes such as asthma admissions and heart attacks among adults. And a lot of the policy focus is around the sort of bans in public places, workplaces, restaurants, and bars. But more recently, they've been extended a bit to a range of locations. So outdoor areas like playgrounds and parks, and semi-private places, and then also private places, including private vehicles. And so a small number of places have got these bans in place where they say if you have children in your car, that's people under the age of 18, then it is illegal to smoke inside the car. England introduced this policy in October 2015, and Scotland didn't introduce it until a little bit more than a year later, so in December 2016. And so this sort of provided this opportunity to have this natural experiment in terms of what is happening in terms of actual exposure of children to secondhand smoke. And we're not going to sort of talk about it a lot in this presentation, but exposure to secondhand smoke is detrimental to the health of children, and the policies are motivated by there being very high level of concentration of secondhand smoke within vehicles, even if the windows are open, but also the sort of inability of children to actually, take action to avoid that exposure. So the data we used, we essentially took 3 data points from each of England and Scotland from these big nationally representative surveys. So the England data comes from something called the Smoking, Drinking, Drug Use Survey. So that surveys children in school and asks them about smoking, drinking, and drug use. And the Scottish data comes from the Scottish Health Survey. Now, because of differences between these data sources, we did have to do some work to really harmonise the measures we were talking about. The Smoking, Drinking, Drug Use Survey has children from 11 to age 15, and the Scottish Health Survey has the whole age range in there. But children under the age of 13, they ask their caregiver, normally their parents, are they ever in a car with someone smoking? And so we considered that's not really a very valid answer, especially if a very valid way to ask that question, especially as you consider it's most likely to be the sort of parents and carers who are going to be smoking inside cars with children. So that meant we had to restrict to this quite tight age range of 13 to 15-year-olds. And also because of differences in the questions, in Scotland, they're asked, are you regularly exposed to other people's tobacco smoke in any of these places? In England, they're asked a more detailed question. And so we've sort of harmonized to make this measure of regular exposure only. And that's sort of considering in the English data, people who are exposed at least once per week. The analyses was a sort of difference in difference approach with this logistic regression binary outcome, or do children report being exposed or not? And so, the key thing really is, what is the change in 2016 when the policy is in effect in England and not in Scotland? We didn't control for a wide range of covariates. We had age, sex, a marker of deprivation, and survey weighting in there. And we did try a few different sensitivity analyses. So we did some analyses in England alone, looking at this wider age range of 11 to 15, and also looking in more granular detail at the sort of categories of exposure that children were reporting. So this is the main. So this paper is a short report, and this is very much the main finding from it. And actually, analytically, I think this is sort of one of those papers where we made this sort of difference in difference design, but even sort of looking at the sort of the raw numbers of percentages over time and country really sort of tells the picture reasonably clearly. So exposure in England's about 6% in 2012, comes down a little bit in 2014, and then when the policy is implemented in 2016, you see this big fall to about 1.7%. So a big difference there when the policy was implemented, and the Scottish data shows that there is this more gradual fall over time. But the difference between these, you can see in 2012, England much higher levels of exposure. That isn't really the case in 2016. So it's an absolute 4.1% reduction of 72% relative reduction in terms of the percentage of children self-reporting exposure to smoke inside cars. A few of the sort of methodological considerations about what we did here is that necessarily the sample size was much lower in Scotland, so we only had about 800 responses from Scotland compared to 15,000 across the whole of England. And we did have to, as I said, we've got this focus on children reporting regular exposure. We did, however, as I say, we conducted these analyses on regular, monthly, and ever exposure, just in the England data where that data was available. And that came to similar results that said in 2016, after the policy, big changes in exposure. The differences in how the question is phrased mean that we can't really directly compare England to Scotland to answer that question. Is there more or less in either country? But with the design, the sort of difference in design, we can't. There's no obvious reason, I would say, why that would change over time. It would cause this sort of effect we have seen. Maybe people have opinions on that, which would be interesting. And again, we've focused on 13 to 15-year-olds, but looking at 11 to 15-year-olds in England had similar results. And the data collection in Scotland, because of when the Scottish Health Survey was, there was data collected in December 2016, which is actually when the policy making it illegal to smoke inside cars for children in Scotland was in effect. So there's a bit of misclassification there, but we think that would probably bias any effects towards the null, if anything. And also because this only goes up to 2016, we're only really assessing the very immediate impact of these policies. I was going to talk about this just quite briefly. We did follow that sort of first paper up with this second paper where we tried to get around a few of those problems. And so we used this data collected by YouGov on behalf of ASH, Action on Smoking and Health, and it uses 11 to 18-year-olds in England and Scotland, data from 2013 to 2020. And it is a sort of a more, in some ways I would say a more sort of traditional interrupted time series, and so you're looking at trends pre the policy, and then is there an immediate impact of the policy, and then trends afterwards. Overall, exposure of children to smoke inside cars was falling from 2013 until the policy was implemented in each country, and you see this 22% relative reduction in the year that the policy is introduced, and then that trend stays stable. So reasonably similar results from this sort of second analyses, which follows things over a longer time period. It's, the relative reductions are quite different. This is 22% versus 72% in the study, the first study, and so it's possible that that's to do with the age range or the questions that are asked, but there are still some questions around why such differing levels of exposure there. And just to say that this, I guess this work on the smoking ban in cars is quite a long time in gestation for me personally. So back when England was considering the policy, we wrote this little letter to the BMJ to say, levels of exposure are much higher in more deprived children. This will, we think, be a sort of policy which will benefit health inequalities. And then the policy was implemented, and we had that sort of first paper about it, which we sort of sent to various places, including this government review of whether or not they should keep these policies being enforced, and sort of cited there as saying, this is a policy which is worth persisting with, and which remains on the statute books. So in conclusion really is evidence that the policy is effective, I would say, in its main aim of reducing exposure to children to secondhand smoke. It is possible that this is only in the short term, and so exposure has been coming down for a time anyway. And if you think of those second set of analyses, it showed after the policy there's this sort of relatively straight trend in terms of what is happening. And it's contrary, I mean, I didn't say at the start, but one of the motivations, I think, to this work is a lot of the press and even sort of policy, a lot of the press you read about this policy says the policy is not effective because no one has been fined for smoking in a car with children. So which really sort of overlooks the fact that the main objective was to reduce exposure to secondhand smoke. And finally, yeah, so we've got these analyses. We don't know the effect in any sort of quote unquote hard health outcomes or any other health outcomes you might think of, so denormalizing or normalizing smoking. But thanks very much. Happy to take questions, and so the links to the two papers are in the presentation. Thanks very much.